Hello and welcome. You're watching News 9. My name is Pankaj Mishra. Now, one of the worrying factors that is raising its head once again is the threat of COVID-19. The central government has asked the states to ramp up the RT-PCR tests and also keep an eye on the cases that are trickling in, especially down south. Excuse me. Now, India has lodged 1,573 new COVID cases in the last 24 hours, while the active cases have been increased to 10,981, according to Union Health Ministry data updated on Tuesday. 4 districts in Delhi, 2 each in Kerala and Maharashtra, and 1 in Gujarat recorded the highest weekly test positivity rate. Amid a spike in COVID-19 cases, the Health Minister of Kerala, Veena George, has reassured the public that the state is well equipped to handle another wave of the virus. To take the discussion further, I'm joined by Dr. Subramanian Swaminathan, Senior Consultant, Infectious Disease, Gleneagles Global Health City. Dr. Swaminathan, thank you so much for taking time out and speaking to News 9. Well, in your opinion, first things first, what are the primary reasons that we are witnessing the spike in the cases as of now, especially down south?
Couple of reasons. I don't know if it's a South only phenomenon because even Mumbai is seeing numbers rising. And I suppose it's probably because of more testing available rather than actually numbers as such. It's probably pan-India. The second thing is that there is a seasonality to many respiratory viral infections that in winters and colder times it tends to spike. And the third thing is probably a waning immunity because a lot of people have not taken their booster. And therefore, we are expecting to see some breakthrough infections at least. The last point is whether there are new variants coming through which are breaking through, which we don't have enough data on. So therefore, that would be speculative. I don't want to unnecessarily alarm people saying there is a new, super monster around. No, there is nothing like that. But we need more data on all of these things. So overall, I would say this is not an unexpected phenomenon. And therefore, at this point, it's important for us to be cautious, but certainly no cause for alarm.
Right. Also, Dr. Swaminathan, we have one of the soundbites coming from Head of Oncology in AIMS. Let's listen to that and then we continue with the conversation.
ऐसा टाइम होता है साल का जिसमें कि सीजनल इन्फ्लुएंजा एंड वायरल डिसीजेस बढ़ती हैं और चूँकि मौसम बदलता है अभी रिसेंटली जो ठंड एकदम से दोबारा से रिलैप्स हुई ठंड का बारिशें भी हुई तो मौसम में जो एकदम तेज़ी से बदलाव आता है तो उसमें वायरल डिसीजेज बढ़ती हैं इसी प्रकार से कोविड इन्फ्लुएंजा कुछ डायरियाज ये सभी बढ़ते हैं तो कोविड भी इसी कारण शायद बढ़ रहा है लेकिन ये कहना कि कोविड का कोई हम लोग ये देख रहे हैं कि कोई एपिडेमिक फॉर्म लेगा ये शायद प्रिपेयर्डनेस हमारी है कोविड केसेस हैं लेकिन जो वो केसेस हैं वो इतने सिम्टोमेटिक केसेस नहीं है जहाँ तक प्रिपेयर्डनेस का संबंध है उसके लिए कोई पैनिकी होने की ज़रूरत तो नहीं है हमारे पास पूरी तैयारी है हम लोग के पास अभी इस वक्त 210 बेड हैं 192 वार्ड बेड 18 आईसीयू बेड हैं शुरू से हमने उसको रखा हुआ है हमारे पास मैन पावर भी ट्रेंड एंड प्रीवियस एक्सपीरियंस वाली अवेलेबल है सारी तैयारी हमारे पास है ऑक्सीजन की भी कोई कमी नहीं है तो सो फार एज अगर सिचुएशन ख़राब होती भी है तो उसके लिए हम फुली रेडी हैं प्रिपेयर्ड हैं लेकिन मेरा ये मानना है कोविड से बचने के लिए आपको जो यूनिवर्सल प्रिकॉशंस लेनी थी यानी कि मास्क लगाना हैंड वॉशिंग करना डिस्टेंस मेंटेन करना उसमें हम लोगों में बहुत ढील या कमी की वजह से शायद हम लोग एट रिस्क हैं इस वक्त
Well, we are still joined by Dr. Subramanian Swaminathan. Dr. Swaminathan, now as the weather pattern is also changing and as Dr. Gupta was also mentioning, the occasional flu that is also coupling with the current COVID situation and also the dip in the immunity level. How best it can be countered given the situation when the flu is also on the rise?
So understand that it's not just H1N1, but H3N2 is also rising. If you look at the US data, at least H3N2 is currently outstripping H1N1 to the post of alpha dog. So obviously there is a lot of other things running around. There's also adenovirus. We're seeing some RSV, parainfluenza, metapneumonia, all kinds of stuff. So all in all, we have a lot of respiratory viral infections, not just COVID running around. For COVID, the value of the mask is kind of becoming iffy because the R naught is so high. But for everything else, actually speaking, the mask and hand hygiene is incredibly beneficial, as also social distancing. So the problem is when you have so many respiratory viral infections going around, unless you start testing each and every patient, you won't know what's happening. We do know that all of these are running around, and there is definitely a good value for a good mask and social distancing and hand hygiene. So I think for the public, at least, following these instructions would be tremendously beneficial, because it doesn't matter what you fall in with. Why would you want to be miserable is a simple question. And hopefully, once the season starts becoming a little warmer, many of these things will quieten down, is what is expected. And that's the general pattern that we see with these kind of winter respiratory viruses. So I think if people can just take care of themselves for another 2 to 3 weeks, I think we should be in a much better position.
Right. Also, as far as the center is concerned, we saw Prime Minister Narendra Modi chairing a high-level meeting last week, and there also the use of masks, the following of the COVID protocol, that was being emphasized upon, and also he took stock of the medicinal and the medical facilities that are available in India. Where do you see, Dr. Swaminathan, right now, the preparedness of India after those specific waves in 2020 and 2021?
So understand that was a different time because we had no clue who our enemy was, and definitely what the implements that we had at our disposal that we could use. We had no clue about it. We didn't really know about the black fungus which would come up after COVID and so many other things. Now we know a lot better, whether it's the inflammatory syndrome, whether it is black fungus, all kinds of things. We are better prepared in terms of medical protocols. The whole world, for that matter, is better prepared. The second thing is the majority of our population today is well vaccinated as compared to what it was even in 2021. So I think we are a long distance from where we started. We are in a much better position. But obviously, there remains areas of opportunity to improve upon ourselves. And that's where the booster vaccine comes in, especially for those who are vulnerable. See, the government is very clear, 65 and above, please take the booster vaccine. I would expand that a little bit and say 65 and above, and those with chronic medical conditions like cancers or organ transplant and things like that, and lung disease. These people should take the booster vaccine as well, because it really makes a difference in terms of preventing severe disease. See, it's the difference between getting a mild viral infection and ending up in a hospital, where it becomes very expensive and could also be very dangerous for your health. So there are a lot of reasons why I think booster and following some simple protocols for could make a big difference. And the vaccine is very safe. We have excellent vaccines today, which all of us have taken, and we know is very, very safe and very, very effective. So I think we have come a long way. We are in a much better situation. But I think the greatest threat to us is our own complacency.
Right. I was actually about to ask you about this complacency that is mainly seen in the youth as well, as far as the booster dose is concerned, as far as the second booster dose is also concerned, because now by the time the government made sure that each one of us gets the second booster dose, by that time obviously the situation had improved and the threat perception had died down. Just to reiterate, Dr. Swaminathan, what are the precautions as of now? Because if a person is demonstrating symptoms of, say, flu, at what point of time should he or she get himself or herself tested so that it doesn't pass on just like any other flu and COVID-19 is timely detected?
Absolutely. So there are things you do for public good and there are things you do for your own personal safety. Starting with public good, you don't want to transmit this to other people, including family members. So self-quarantining yourself for a couple of days is probably the most sensible thing you can do, because you really don't want to give flu or COVID or whatever adenovirus to other people. So you may be young and healthy, but your grandfather or your grandmother or your parents may be older with medical conditions, and they can ill afford this infection, and this could be really, really dangerous for them because it could trigger a heart attack. It could be any number of things. So why do that? So let's be sensible and let's self-quarantine ourselves if we have symptoms. The second thing is, if you have not got the vaccine, if you've not got the booster, get it as quickly as possible. Third, if you have symptoms, see your physician as quickly as possible. Don't go to the pharmacy and over-the-counter medicate yourself, because it's not a question of inky pinky bonky, let me take the medicine for flu and let's see what happens. It's better to check yourself out, ask your doctor whether there is a role for an antiviral, there's a role for testing, and based on that, make decisions on what needs to be done. And for heaven's sake, do not forget to wear your mask, especially if you're symptomatic, because you really don't want to go around giving this to other people when you go to your healthcare provider. Because remember, there are other people who have chronic medical conditions who can absolutely ill afford to bring all these things to catch all these things from you. So please be socially responsible, wear a mask, and try and minimize your time outside the home as a public service. And yes, simple things will really help. Hydrate yourself, take paracetamol, be liberal with it. Talk to your doctor, obviously, before you do anything. And, common sense measures will go a long way. Don't go to work even if you're not feeling well, because you may have a mild disease, somebody else could have a catastrophic illness. So I think those kind of simple things can make a big difference to us and for the people around us.
Right, Dr. Swaminathan, one final question before I let you go. For all those, citizens who want to travel abroad or those who are coming to India, as of now, the government of India has not put any restrictions. Maybe regular checkups are there on the airports. But do you believe that once, the influx of people from foreign shores to India, do you believe that it is time, or maybe in the days to come, it will be required to screen them at the airports?
You can't catch the air. Let's not try and do that. It's an unproductive intervention. See, it's not like these viruses are not in India or not in some other country. They are everywhere. So I think airborne infections and droplet infections like this, trying to control them is just impossible. And most of these seasonal infections are fact du jour in almost every country. So it's not like they need to come to India to give us adenovirus or H3N2. We already have all of those. So I'm not sure that makes big difference. So let us choose the interventions which make sense, because remember, people are also tired about the number of interventions we do. So let us make sure that the interventions we do really are going to pay off well, and not just they're not just there just because we can make an inconvenience and make everybody aware of it. So it should be endpoint driven, and therefore I think those interventions, unless there's a new strain coming or something like that, really, no, I wouldn't say that is big value.
Right, Dr. Subramanian Swaminathan, thank you so much for speaking to us and breaking down the do's and don'ts as far as the spread of COVID-19 is concerned. And also, Dr. Swaminathan clearly mentions that there are some things that you do good for the society, and there are some precautions that you take for yourself. Senior Consultant, Infectious Disease, Gleneagles Global Health City, Dr. Subramanian Swaminathan was speaking to us. And as far as the COVID-19 spread is concerned, well, the center also has taken note of the situation and is keeping a close eye along with the state governments as well. This brings us to the end of this broadcast. More news and updates continue on News 9.